Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is briefly made clear and often illustrated. Today's topic is about hemophilia. Hemophilia is a recessive inherited disease linked to the X chromosome of the female sex. However, the disease manifests in male. Women are carriers of the gene but rarely manifested. About 5 to 10% of people with hemophilia A have a factor 8 protein defection. The rest of patients produce factor 8 in small amounts. Diagnosis use blood test rather than genetic test. To understand hemophilia, it is necessary to make a genetic and hemostatic recall. Hemophilia is X-linked recessive disorder. Father, normal, XY, mother, XX carrier. One son is affected, XY. One son is normal, XY. One daughter is normal, XX, and one daughter is carrier, XX. X-linked recessive, no male-male transmission, expressed only in male, female are carrier. Female are carrier. Expressed only in male. No male-to-male transmission. 3 types. Hemophilia A, deficiency in factor 8, most common. Hemophilia B, deficiency in factor 9, it's rare. Hemophilia C, deficiency in factor 11, it's more rare. Hemophilia A and B are clinically similar. They occur in 1 over 5,000 male births. 90% of congenital bleeding disorder. Hemophilia A is 5 times more common than B. Hemophilia A is inherited as an X-linked recessive trait. It occurs in male and in homozygous female, which is only possible in the daughter of the hemophilic male. About 5 to 10% of people with hemophilia A are affected because they make a dysfunctional version of the factor 8 protein, while the remainder are affected because they produce factor 8 in insufficient amount. Initial diagnosis is done by measurement of protein activity rather than by genetic test, though genetic tests are recommended for testing of family member once a known case is identified. Symptoms include muscle, reduced movement use, limping, inability to put a heel on the floor when standing or walking, digestive, red or black stool, bleeding from the hair, irritability, sleepiness, unable to wake up, and seizure. Diagnosis: increased PTT, partial thrombin time, normal PT, prothrombin time, and normal BT, bleeding time. Diagnosis is made in the presence of very low level of factor VIII. Recently, genetic testing has been made available to determine an individual risk of attaining or passing an hemophilia. Diagnostics include a severity level. It can range from mild to severe based on the amount of active and functioning factor VIII. In matter of hemophilia, it should be known that what brings the patient to consult is bleeding. We are going to see what makes the bleeding of the hemophilia patient different from other bleeding. Regarding primary hemostasis, it's about a superficial bleeding, petechial and oral gingival. Platelet count, if it is normal, it could be von Willebrand, Bernard-Soulier, and Glausner thrombocytopenia. If platelets are low, DIC, HIT, TTP, ITP. Primary hemostasis, think about superficial bleeding, epistaxis gingival, dental procedure, petechial, and vaginal bleeding. Superficial bleeding include purpura, 3 to 10 millimeters, petechial, less than 3 millimeters, different from ecchymosis, more than 1 centimeter. Secondary hemostasis, deep bleeding, mean hematoma or hematosis. Mixing study, if correction is negative, it's hemophilia A or B. If correction positive, it could be vitamin K deficit, taking comadine or cirrhosis. Hemophilia, deep bleeding, deep joint, hematosis. Let's recap. Inherited blood disorder factor VIII, classic or type A, intracranial hemorrhage, prolonged nose bleeding, bruises, warm, painful, swollen joint, GI hemorrhage, treatment, intravenous administration of deficient clotting factor, and good nutrition, good dental hygiene, avoidance of aspirin. Sometimes it is difficult because of painful hematosis. No intramuscular injection. Hemophilia B is characterized by the deficiency of factor IX, same symptom as hemophilia A, treatment otherwise. Recombinant factor IX instead of recombinant factor VIII, use tranexamine acid to slow the rate of bleeding. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like, subscribe? Your comments are very welcome. Thank you.